The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Julie is a 10-year-old girl presenting to your clinic today with her mother. She is concerned about the missing eye teeth in both the jaws and about Julie's appearance because of the split front teeth. She also feels that the front teeth are too big. She is able to feel a bulge in the lower jaw but not in the upper jaw. Address patient's concerns, gather information, and the necessary investigations.
The pointers here would be assure the parent about the appearance, discuss investigations and the importance of waiting, and treatment options for future. Let's start the role play now. Hi, Mrs. Smith. How are you going?
Hello, doctor. I'm good. Well,
Good. How's Julia doing?
she's good too.
That's good. I understand you have some concerns with regards to her appearance. Is that right?
Yes, I feel like her teeth are too big in the front and that her eye teeth is not out yet.
Okay. And I just have a few questions to ask about this. Is that okay?
Yeah, sure.
So, since how long have you noticed this change in her appearance?
From when her front teeth started growing.
Okay. And before that, has she been okay with regards to her milestones with, the rest of the teeth? Have they all come through?
Yes, no problems at all.
Okay. And has there been any delays apart from these teeth?
With her other teeth?
Yes, yeah.
No, I think they're all quite on track.
Okay. And as a child, did she have any injuries or anything particularly around those areas with those teeth or anything like that?
No, she's a careful child.
Okay, that's good. And how about your pregnancy? Did you have any problems while you were pregnant?
Not at all. Quite a smooth ride.
Okay, that's great. Okay, now with her past dental history, can you tell me if she's been seeing a dentist in the past? Has she had any treatments done, any issues that she encountered?
She does have some regular checks in her school. Apart from that, we haven't really taken her out because they always tell that she's quite fine. So
Okay.
she didn't need a review outside.
Great, that's good. And medically, is she fit in well? Does she have any
Yes,
medical problems?
nothing at all. She's all good.
All good. Any allergies?
Nothing that we know of.
And even with her medical milestones, generally, was she all good with her age?
Yes, she's been fine.
Great. That's good to know. Now, do you recall anyone else in the family who probably have a similar appearance or similar issue with, the teeth not coming through at a certain age?
Well, I've not really given that much of a thought or noticed it correctly, but some of them do have like a bigger teeth or something, but I don't know if they have a missing tooth.
Okay. Does she have any habits such as thumb sucking or any things that you would notice in particular?
She had them as a child probably till when she was 3 or 4,
Okay.
but nothing since then.
Okay.
She did suck her thumb.
All right. Okay. And she didn't do that for too long? How long?
3 or 4 years of age, that's
Okay.
it.
Okay. So not currently doing it.
No.
Okay. Great. That's good. So, looking at all the information that you have presented to us, and even just looking at the picture that we had taken today of her teeth, what I suspect is that there could be a few reasons why this is happening. So, there are two things. The tooth may be either present or absent. It's as simple as that. But
Okay.
if it is present, then there are reasons that it is not probably able to come out just yet, because maybe there's inadequate space there, or even if there is space, there's the size of the jaw is probably still not sufficient for the tooth to come through, and sometimes it could just be in there, it's impacted. That's what we call in dentistry. But like an external force sort of is preventing it from coming through. So it could be like an extra tooth in there, or or if there is a cyst around that tooth as well, that also prevents it from coming out. Sometimes there could be a curved root that probably is leading to that tooth being hooked on into the bone, and that's probably why it's not coming out. Either way, we still need to do an x-ray, a big x-ray, which shows all the set of teeth and the bones and everything that's in the jaw, and that way we'll know how to progress further.
Okay.
Is that also clear so far?
Yes, I am understanding what you're trying to tell me. Yes.
All right. Now, with the x-ray, once we do that, I'll have a look to see, if the teeth are present. And if they're present, and say we have not encountered any of these issues that we've spoken about before, with regards to the space, with regards to the, the cyst or the curved root, and all these reasons that I was saying, it could then just be a matter of time. So then we just need to wait for those teeth to come out on its own. But let's say that the teeth are absent. Then that's when we will have to take this further. We will then have to refer you to see a specialist who will then discuss what needs to be done to close those gaps once all those teeth come through. That's the planning that the specialist who needs to do that.
Okay, so we need to take an x-ray and then we need to go to the specialist. Is that right?
Yes, that's right.
Okay.
Going to the specialist is only if those teeth are absent.
Okay.
Yeah. If the teeth are present, then I would suggest that, if there are no other issues, we can just wait for it to come through. All right. Is that all clear so far?
Yes, I'm quite clear, but what are we going to do about it today apart from the x-rays? Anything to help her probably grow the jaw faster, or bring the splayed tooth together?
Now, the splayed teeth, you don't have to worry about it straight away.
Okay.
It's quite normal for those teeth to look like that at this age, because this is the age where all the other teeth are still coming through. So sometimes when the eye teeth are coming through, it can put a little bit of a pressure on the front teeth, and so that might actually appear like it's splayed. But once the eye teeth start moving down, it will close that gap. So most children, you will notice that within a year or so, their appearance will change.
Okay.
But there are other reasons why these teeth could be splayed as well. So sometimes it could be because if there's like a very thick tissue in there, or like an extra tooth that we were discussing earlier, that can also lead to this gap.
Okay.
But either way, the x-ray will help us predict what to do next. But the gap will resolve itself if we have no other reasons to worry about.
Okay.
Yeah. So if there is nothing else that needs to be done, then we only just need to wait to see. So we'll review her again in 6 months, and if at that point it still not come through, then we will just think about doing something else to push those teeth to come out. So that's when I would really think of sending you to a specialist.
Okay. Sounds good. Anything to help her?
Okay. Any other questions for me, Mrs. Smith?
Not really, I think. Yeah, let's see if Julie has something to ask. But
Yeah,
from my
absolutely.
side.
Yes. Okay, that's all good then.